Alteration and neurological dysfunction. Part 3. Spinal shock causes complete loss of reflex function below the level of injury, and it's due to edema at the site. It usually resolves in 7 to 20 days, but it can last as long as 3 months. Symptoms are paralysis, loss of sensation, a drop in blood pressure, and disruption of thermal control. When it resolves, it causes hyperreflexia, spasticity, and reflex emptying of the bladder and the bowel. Pardon me. Autonomic hyperreflexia or dysreflexia is when you have an uncompensated cardiovascular response to sympathetic nervous system stimulation. This occurs because your autonomic nervous system is intact, and it responds by causing hypertension. This occurs if you have a spinal cord injury at T6 or above, and the cause is usually distended bladder or rectum or pressure on the abdomen or a pressure ulcer, something that causes this abnormal response, and you end up getting hypertension. Now your baroreceptors will sense that hypertension and stimulate the parasympathetic nervous system to cause bradycardia. So you end up with marked hypertension, like 250 over 150, and bradycardia, heart rates in the 40s. The hypertension gives you the headache, and the autonomic nervous system response causes the sweating and the nausea. This impulse cannot travel through the cord, so the peripheral vessels themselves do not dilate, and that's another reason you get the high blood pressure. And this is showing autonomic dysreflexia, spinal cord injury at T6 or higher. Some of the different things that might cause it. Trust your patient when they say they don't feel right. They will know. They will know. Low back pain is oftentimes due to degenerative disc disease. It tends to occur in people over the age of 30. You'll have fibrous cartilage that replaces the gelatinous material of the nucleus propulsus in the spinal column as the disc ages. And you have back pain when you move. Spondylolysis is a structural defect of the spine that can be due to, usually due to heredity. It affects the lumbar spine, puts mechanical pressure that causes a forward displacement of the vertebrae. This low back pain could be due to tumors, disc prolapse, bursitis, degenerative joint disease, bone pressures, fractures or sprains. 70 to 90% of all patients all people have some form of back pain at some time. Spinal stenosis is narrowing of that spinal canal that occurs. Low back pain will radiate into the thighs, and the usual cause is idiopathic. Otherwise we don't know what causes it. Or it could be a sprain or a strain. Risk factors are those occupations that require twisting, or obesity, smoking, and osteoporosis. As I mentioned, the usual cause of the spondylolysis is heredity. And if you have forward displacement of that spinal column, it's called spondylolisthesis. Herniated intervertebral disc is when you have protrusion of part of the nucleus propulsus through a tear in the posterior rim of the annulus fibrosus. It usually occurs in men between the ages of 30 and 50 because they don't necessarily lift appropriately. The gelatinous material will extrude and compress the nerve root. Symptoms are pain that radiates along the sciatic nerve. That is worse when you strain or cough. They'll have decreased range of motion, weakness of their feet, and paresthesias. Cerebral vascular disorders are an example is a thromboembolic stroke or cerebral thrombosis. You have arteries that supply the brain that are occluded by a thrombus or clot, preventing adequate blood flow to the brain. Risk factors are atherosclerosis, coagulation disorders, hypothyroidism, and sickle cell disease. A TIA is a transient ischemic attack. In this, the platelets will clump, and that causes an intermittent blockage of the cerebral perfusion, or it could cause spasms of your cerebral arteries. The deficits are gone in 24 hours. 35% of the time it will precede a CVA, or a stroke. So this is a warning symptom. An RIND is a reversible ischemic neurological deficit. In RIND, the patient will have symptoms that last for up to 3 months, and then they'll go away. There is no permanent deficit. Again, it's another warning. A stroke in evolution is the progression of a stroke, where they continue to develop more and more abnormalities until the vessel is either totally occluded or the bleeding is stopped. And a completed stroke is when the stroke is completed and there are no new deficits. Now, an embolic stroke is where an embolus causes ischemia. Risk factors are atrial fibrillation, because anytime blood pools, it clots. And acute MI, because again, you may have a decrease in contractility. Endocarditis, inflammation of the inner lining of the heart that can cause, or blood vessels, but endocarditis is of the heart that can cause a clot to form. Rheumatic heart disease, valve replacement, or an atrial septal defect. All those are possible risk factors, because in all of them, you may have clots forming. A hemorrhagic stroke is usually caused by hypertension because the blood pressure gets so high, it causes a vessel to rupture. So it causes a ruptured aneurysm, or an AV malformation may be another possibility, where your arterioles and your venules get all twisted up inside each other, and circulation through them is delayed, and the pressure builds up and can cause a rupture. Patients who develop a deep, unresponsive state rarely survive a hemorrhagic stroke. Now, a lacunar stroke is very small. It's less than 1 centimeter in diameter. It's usually the result of hypertension and tends to be either pure motor or sensory deficits that are seen. And it can cause changes in their speech patterns and accents. There was a lady in the news a couple years ago who lived in Scotland, and she went to bed speaking Gaelic with a Scottish accent, and she woke up in the morning and her accent was that of somebody who lived in South Africa, with a Swahili accent to it. And it stays. It stays. This is how we recognize a stroke. You ask the person to smile and stick out their tongue. Remember, the tongue will deviate to the good side because the muscles on that side are stronger. You ask the person to make a complete sentence, and they don't necessarily do very well with that. And you ask the person to raise both arms. If there's anyone who cannot do any of those steps, call 911. Get them some help. This again is looking at a stroke, a brain accident, or stroke. Looks at nursing considerations. Both of these are from the memory book, as is this one, where again it's looking at a stroke, talking about a TIA, some changes that may occur, the hemiparesis, hemiplegia, the Horner syndrome, which is ptosis of your upper eyelid, and so the changes, the I can't say it, hemangiopsia, anyway, where you only see out of half of your vision. Remember, when you have vision problems, it's the half of each eye, so it's like you're seeing through stripes, as you can look at that here. And then this is someone who's had a left-sided CVA, showing you the difference, and someone with a right-sided CVA. So these are from the memory book and should help you understand these concepts, hopefully a little bit easier. Intracranial aneurysms are usually located at the bifurcation or near the circle of Willis, which is at the base of the brain and supplies the brain with most of its blood supply. These are usually female, between the ages of 35 and 60. And the aneurysms themselves are either saccular or fusiform. Remember, fusiform involves all three layers. Saccular is kind of like an outpouching and is sometimes called a berry aneurysm because they look like berries. Arteriovenous malformation is a tangled, dilated blood vessels that create abnormal channels between your arterial and your venous system. The vessels are abnormally thin, and as a result, the patient will complain of headache, may develop a migraine, or have seizures. Subarachnoid hemorrhage is bleeding into the subarachnoid space. It's due to an aneurysm, AV malformation, or hypertension. Blood will irritate the neural tissue and coat the nerve roots, impairing cerebrospinal fluid reabsorption by clogging the drainage areas and impairing cerebrospinal fluid circulation. It will cause hydrocephalus. Symptoms are headache, change in your mental status, change in your vision or speech, numbness, tingling, increased intracranial pressure, nuchal rigidity, nuchal meaning neck. The neck gets really stiff and it hurts when you bend the head. It's another symptom of meningitis that occurs, is nuchal rigidity. You'll have photophobia, slurred speech, and maybe a low-grade fever. And speaking of meningitis, it's an infection of the meninges. If it's bacterial, it's due to Neisseria meningitidis, Streptococcus pneumonia, or H. influenza. It irritates the meninges, causing inflammation. The neutrophils will migrate to the subarachnoid space, causing the cerebrospinal fluid to thicken so it doesn't drain as well. That thickened CSF can cause hydrocephalus and increase intracranial pressure. Tends to occur mainly in the young. You'll have nuchal rigidity, again, a stiff neck, and it hurts to bend that neck forward. Patient will cry out. A severe headache, increase in intracranial pressure that can cause papilledema and delirium. Remember the papilledema we talked about under senses. And fever or rash. Aseptic meningitis is a viral in origin. It's usually caused by the mumps, herpes, or herpes simplex type 1 virus. Symptoms are headache, nuchal rigidity, fever, and weakness. So the symptoms are basically the same for viral and bacterial. Fungal meningitis is uncommon, but it is a chronic disorder. It will produce granulomas at the base of the brain. And because it's at the base of the brain where the cranial nerves exit, it can cause dysfunction there. It can cause thrombosis, infarction, and hydrocephalus, as well as dementia. But the patients who have fungal meningitis have no fever. They are afebrile. Meningitis in children, if it's bacterial, is due to Neisseria meningitidis about 60% of the time. Strep pneumonia, if they're over the age of 4. E. coli and group B hemolytic strep, mainly in infants. This bacterial meningitis in children tends to be boys more than girls, more so in infancy and after an upper respiratory infection. Viral meningitis is due to direct infection or secondary to measles, mumps, herpes, or leukemia. Symptoms are weakness, fever, headache, stiff neck, abdominal pain, nausea, vomiting, sore throat, chest pain, photophobia, and a rash. Children viral tends to resolve on its own within 3 to 10 days. Because remember, viruses do not respond to antibiotics. An abscess is a localized collection of pus in the parenchyma of the brain and the spinal cord. Tends to affect men between the ages of 30 and 40. Symptoms are due to that expanding lesion and the infection, so they'll have like a localized pain, purulent drainage from the nose and the ear, fever, seizures as a possibility. And intracerebral occurs from the vascular source. So symptoms are fever, headache, neck pain, stiffness, confusion. They're very drowsy. As it progresses, they'll develop that narrow visual field, ataxia, and dementia. Extradural is associated with osteomyelitis in the cranial bone, and this one tends to have fever, purulent drainage from the nose and the ear, localized pain, and maybe even seizures. Spinal cord abscess are what you'll get the symptoms of a spinal ache, spasms of your back muscles, weakness, and paralysis. There are different types. Your spinal epidural abscess forms in the epidural spaces. This is due to osteomyelitis of your vertebrae, and it's very common in diabetics. Intramedullary spinal cord abscess forms within the spinal cord. This is common with patients who have sepsis. Encephalitis is commonly viral in origin. It causes a widespread nerve degeneration, and symptoms are those of fever, delirium, confusion, coma, paralysis, palsy, which is a shaking, and abnormal reflexes, and I think I forgot to mention seizures. Multiple sclerosis is destruction of your myelin sheath. The cause is unknown. They don't really know. They think it might be an invasion of a virus. But the myelin target is a target of phagocytosis, with edema and inflammation. And then plaques form to prevent normal transmission of your nerve impulses. Tends to onset between ages 20 and 40. Women more, and Caucasians more. Initially, you'll have periods of remission, but usually you have permanent disability after 20 years. You'll have paresthesias, dysarthria, and ataxia, and you'll end up having to be in a wheelchair. It starts usually with the feet and moves upward. If any of you know who Annette Funicello was, she was a star of the Mickey Mouse Club when I was a little girl, and then she starred in the beach party movies of the 60s, and had quite a career. Very pretty lady. She's currently in a wheelchair from multiple sclerosis. It's no longer remitting. And this is a flow sheet showing the etiology. You have invasion of an immunologically susceptible individual by a virus that has a prolonged incubation period. So we don't know when they got it, but somewhere between their 20s and 40s it starts to show up in early adulthood. And you're going to have demyelination of those peripheral nerves. And when those peripheral nerves are demyelinated and plaques form, nerve transmission is lost, and you'll have diffuse lesions. The interaction between the central nervous system and the systemic immune system is involved, and IgG synthesis in the CNS is impacted. So you end up with somebody whose IgG doesn't function quite as well as it should for them. And here again is from the memory book showing multiple sclerosis. Usually autoimmune, usually female, familial, can cause tinnitus or tinnitus, does affect your hearing, causes nystagmus, which is a fluttering of your eyeballs, diplopia, double vision, blurred vision, dysarthria, and dysphagia. And there are some other symptoms there. This finishes part 3, I believe, of neuro, and we'll start the final part in just a minute.